Welcome to EnVision Center News. Today's episode is with Olivia Luther from Kaniksu Community Health and Jackie Carter, our spin coordinator.
Welcome. I'm Jackie Carter, Service Provider Coordinator for the Community Resource EnVision Center, and today I have the privilege of talking to Olivia Luther, Director of Community Relations for Kaniksu Community Health. Welcome.
Thank you. It's nice to be here.
Thank you, Olivia. Olivia, can you tell us what brought you and your family to this area?
Oh, yes. Okay, so my mother and my two youngest brothers moved here 24 years ago. So I've been visiting the area at least twice a year for all that time. And then in 2011, my mother had some health issues, and I came up to care for her through that and never left. Wasn't intentional, but I fell in love, and I decided this is where I needed to be.
Awesome.
Yeah.
So you are the Director of Community Relations for Kaniksu Community Health. What led you to work for them?
Oh, we could blame. Should we say blame? No, it's an honor and a privilege to work for Kaniksu. But Kevin Nepper, who is our CEO, currently he was our former CFO, recruited me about 7 years ago. He approached me, said, "I want you to do this job." And I'm an art historian by trade. I've been a museum director for years. I was actually a director of the Bonner County Historical Museum. And I said, "Oh, I don't know anything about healthcare. Like this, no. Why do you want me?" And he said, "I love what you're doing, and I want you to come do that for us." And I said, "Oh, no. And it took him about 8 months. But I believe in mission-driven organizations. And I just felt called to the mission of Kaniksu, and I thought, this feels right. And I thought, well, let's give this a try. And I've been there 6.5 years now.
Wow, smart guy.
Yeah.
So Kaniksu Health Services, now Kaniksu Community Health, got started in 2002 with an idea to provide quality, affordable, and accessible health care for everyone in North Idaho. In that time, Kaniksu Community Health has served approximately 44,000 patients during 655,000 patient visits. Your values are still strong. You're still providing quality health care with a vision for the future. After 19 years, what is the next chapter for Kaniksu Community Health?
You know, I think if you asked us that 2 years ago, our answer might have been a little different. Being in a pandemic right now, all of our energy is just focused on today. How do we keep our staff safe, our patients safe, our community safe and healthy? And so most of our energy goes there. After that, we have a number of things that we're thinking of, things that we're looking at as areas of opportunity for growth, for partnership. Some of those are an aging program. You know, our senior population is our fastest growing population. We do have our new mobile clinic that we're looking at ways we can maximize that for our outlying communities. Childcare, transportation. So there's a lot of things, housing. You know, how can we use our resources to help the community, to help our community partners, to help our patient population. So lots of things in the work, but really right now that focus is COVID.
Oh, good. Thanks for answering that. So Kaniksu Community Health has been ranked in the top 10% of community health centers across the nation. How did you get that amazing ranking?
Hard work. Lots of hard work.
I bet.
A number of things. One, you know, the healthcare landscape is constantly changing. And so we have to stay nimble and flexible so that we can change with that. So that's a big part of it. As changes come down, whether they're federal, whatever the changes are, we look at ways to accommodate them, to work around them, to work alongside of them. But I think most importantly, it's our staff. They believe in our mission as well. They are dedicated to serving our patients, and we have an amazing quality team that works with our care teams on a daily, weekly, monthly, annual basis to make sure that nothing's falling through the cracks. Where are patients missing opportunities for their health care? Where can we help them along, whether it's through care management or resources? Sometimes a patient's saying, great, I know I need to get that treatment, but right now I'm having trouble getting firewood in. I don't know where I'm going to get firewood for winter. And that's a real concern for them. And that's their top concern. And so we say, okay, we can connect you to the Community Resource EnVision Center. I'm going to get that wrong, but and say they're going to help you so that you can then come back and focus on your healthcare. So as a community health center, this is kind of a long answer to your question. Also, we do receive a federal grant annually. It's a competitive grant that we apply for, and that is directionally proportional to our self-pay population, which is about 13% of our patient population. And that really helps us subsidize the costs of their health care. To get that grant, we can't just say we're making our patients healthier. We have to prove we're making our patients healthier. And that's a lot of reporting. So it's a lot of hoops to jump through, but that means that our quality is right up there. And it's a big honor, and one we don't take lightly.
Yeah.
Yeah.
Wow. So health centers such as Kaniksu Community Health provide tremendous value and impact to the communities they serve, including jobs and economic stimulus, savings to Medicaid, access to care for vulnerable populations. How has Kaniksu Community Health been part of that impact and savings?
Well, community health centers, we serve 1 in 11 people across the nation. That's a really big patient population. So when you're talking about savings, you're talking about tens and hundreds of millions of dollars that we can save. And let's go back to that idea of quality. If we are making our patients healthier, we're getting better health outcomes. That means we're keeping people out of hospitals, out of emergency rooms. And those are the things that actually drive healthcare costs up. You know, there's sometimes that misconception that, oh, I'm coming in annually for care. That's silly. I'm healthy. Why do I need to come in for that annual wellness check? Well, if you stay healthy, right, you're not going to go in for some major thing that's going to cost a lot of money. So that's one of the ways we have a really strong impact is there.
Oh, that's amazing. Yeah. So Kaniksu Community Health serves both Bonner and Boundary counties. Where are your current center locations?
Well, currently we have Bonners Ferry, Priest River. We have Ponderay, and we have our Sandpoint Pediatric Clinic and our Sandpoint VA Clinic. That's through the end of the year. And then we'll be combining 3 of those clinics into one purpose-built clinic.
Okay, and so that's the new center in Sandpoint, right?
Yes.
So why did you choose that location?
Well, let's see. A couple of reasons. One, we wanted proximity to the hospital. In emergency, we need to get our patients to the hospital really quick. And we didn't want a railroad track between us and the hospital in the case of emergency. So we've been looking at spaces for about 6 years. When this perfect location came up for us, early last year. And it just was the right fit, and we decided to go for it, and it all worked out. And so we plan to be done. Right now, our hope is to be done and moved in by the end of the year and opening to our patients on the 3rd of January.
Oh, wow.
Yeah.
Exciting.
Fingers crossed. As long as there's no supply chain interruptions or anything like that, it should work.
Oh, awesome.
Yeah.
So Kaniksu Community Health provides all your healthcare needs under one roof, such as medical, dental, behavioral health, veteran needs, substance abuse programs, in-school behavioral health for youth, and mobile clinics. Are there any additional services Kaniksu Community Health might be offering?
Let's see. That's a long list. Patient assistance. This is one of our really important departments, in addition to all of those, of course. But patient assistance has multiple arms. One is medication assistance. So if you have a patient who may be uninsured and they need a medication that they can't afford, we can work with the pharmaceutical companies to get free or low-cost options for them. And then patient assistance, which is, it's funny, it's a 3 umbrella. It's all under patient assistance. But true patient assistance is that idea where we're connecting patients to resources outside of the medical realm, whether it's helping to pay an electric bill or transportation costs or anything like that. And then insurance help. So we can help them sign up for Medicaid, Medicare, how to navigate the insurance exchange through Your Health Idaho. We can help them fill out disability forms, Social Security forms. Again, anything that's causing a barrier for them, we're there to help them through that.
That's exciting.
Yeah, and it's all free of charge.
Wow, what a great benefit to our community.
Yeah.
Thanks for sharing that. So, Olivia, the last question. Kaniksu Community Health and the Community Resource EnVision Center have enjoyed a long collaborative relationship. How could we, the Community Resource EnVision Center, collaborate with you to get the word out to our community about your great services?
I just think things like this. This is perfect chance for us to let people know a little bit more about what we do. When you are helping someone, let them know about our services. If there are areas of partnership, we're always open to things like that where we could help. It's a cross beneficial relationship. So I think what you're doing is great. We're huge supporters of what you do over here. And we refer a lot of patients your way. And so I guess just that same thing, keep referring them our way.
Awesome. Well, that's wonderful. Thank you for taking the time to be with us. I know you're super busy, and we always enjoy having you here. So thanks you again, Olivia.
We appreciate it.
And wish you the best in your new location.
Thank you.
Thanks for listening to today's episode. For more information, you can go to crecidaho.com. Please like, share, and subscribe. We will see you again soon.